Welcome back to Fox 10 News at 4. October is Breast Cancer Awareness Month, and it's important to get screenings even during this pandemic. We have Dr. Rachel Hunter here, a breast surgical oncologist, joining me now with more on the importance of making sure that you're getting those checkups and your mammograms. All throughout my neighborhood, I can tell you there are signs posted reminding people to get checked. Are you finding that people are not, though, because of COVID-19?
Ladies, we are. We're seeing a decline in patients coming in for their breast screening tests. Actually, early statistics have shown that breast screening exams went down by 85% after the first case of COVID-19 was diagnosed. And mammograms have also followed with that. And the decline has just continued to grow throughout the months.
So elaborate on how that can adversely affect someone.
So, skipping a couple of months, pushing your mammogram back just a little bit is really not that big of a deal. But getting it entirely, that's where we're starting to see issues. Some women's are getting their mammograms every 2 years, maybe they're on a 2-year plan. So for them, if they skip, we're talking 4-year gap in between getting their mammograms, and that's huge. Because of that, that translates into patients presenting with later stages of cancer at the time of diagnosis, meaning a bigger size primary tumor, or it's already spread and they present with metastatic disease.
Right, and as we know, with any cancer, early detection is key.
Absolutely.
So what would your recommendation be for someone who's reluctant to go in? Can you do that virtually?
Sure. So we can do, virtual appointments over the phone. It's hard to do exams that way. So if you're just coming in for a screening, I would say make that appointment, come in. I want to encourage everybody to do that, and to also let people know that we're taking every precaution possible at South to prevent the limit of exposure in terms of screening when they come in, taking their temperature, and sanitizing the rooms in between each patient encounter.
And speaking of South, I know that you're relatively new to the system. What drew you to the hospital in terms of where it stands with treatment and screenings for breast cancer?
Yeah, so I was drawn to South because one of the big things that we're able to offer patients, which I think is extremely crucial now given, the COVID-19 pandemic, is we understand how precious patients' time is, and we want to limit your exposure. So when patients come to Strata to get a mammogram, they're going to get same-day results. Meaning if you come in for a screening mammogram, you're going to leave knowing that day whether it was abnormal or normal.
Wow.
And if it's abnormal, we can go ahead and do your workup with diagnostic imaging, a biopsy, and a surgery consultation all within the same visit, which is unique to our system.
Yeah, and it's great too for peace of mind.
Absolutely. That whole process is so anxiety provoking. So to be able to provide women with those quick results, quicker access to care, it's just huge. It means everything.
Yeah, thank you so much, Dr. Hunter, for stopping by.
Absolutely.
And this is a very important reminder, but of course, we want you to follow through. So we'll have this information for you posted on our YouTube channel, the whole interview, so you can watch it shortly after this newscast, and be sure to subscribe so that way you never miss any of our videos that we post there.
Great.